So amoebic abscesses are going to be another one of those diseases where we're going to see it by ultrasound, but we can't definitively say what it is. And again, this is where history is so important for these patients. So let's take a look at what leads to amoebic abscess and what it looks like by ultrasound. So amoebic abscesses are caused by this protozoa called the Entamoeba histolytica. So it's an amoeba that is typically found in water, and it is in the intestines normally. But we know that blood from the intestines goes up through the portal vein and back into the liver. So that's exactly what happens. These amoebas somehow get into the portal venous system and then travel to the liver where they hang out and then create an abscess. So thankfully in the US, we actually have really good water quality and food quality, but there are parts of the world that don't have the same standards. And so in the US, if somebody presents with a possible amoebic abscess, they most likely have traveled somewhere that has a lot of these amoebas in their water or in the food. So that's the most common way that somebody might contract the amoeba. The less common way is unprotected anal sex. Again, this amoeba does hang out in the colon, so that is a pathway to transmit the amoeba from one person to another person. When these patients present in clinic, they are going to have your classic infection symptoms. They're also going to present with some abdomen pain, diarrhea, and pleuritis, which is pain with breathing. Treatment for these patients is going to be medication, or what we could possibly do is go in, stick a needle into the amoebic abscess, and then drain it. So let's look at what amoebic abscesses look like on ultrasound. So here we have an amoebic abscess. What I want you to take note on this is that it is hypoechoic and it takes on a very round or oval shape. Typically the borders are going to be very distinct and smooth. And they are usually found in the right lobe, and they can be singular or multiple. So as you can see, amoebic abscesses are not particularly clear on ultrasound. They do take on the same appearance as a lot of other things that we can diagnose by ultrasound. So of course, the patient history and then any sort of lab work that they might have will be the definitive diagnosis. Make sure though that you are able to describe amoebic abscesses by ultrasound terms and fit a good history in with it.